here we are. This is Sex Love Psychedelics, and I'm your host, Dr. Kat. Bringing you psychosexual conversations that will leave you intellectually turned on and hungry for more.
So, as we're coming to near the end of this conversation, there is one more topic that I know you do a lot of research around and you advocate a lot around. You brought it up in our Burning Man conversation, the Burning Man panel. And the reason why it stuck in my mind is because I was like, wow, nobody's really talking about that. I haven't heard somebody talk about that. And it's the concept of traumatic brain injuries, TBI. I have had clients have TBI and see how it impacted their relationship. You know, they were more irritable. They weren't able to function as quickly. They had to process things slower or feel jarred with processing. And so the work that you do, I want to hear about that, because there's people out there who are getting frustrated with their partner because their partner's not operating the same way that they did.
Yeah, I'm glad you brought this up. So traumatic brain injury is very prevalent. You have all kinds of people who experience all kinds of things and end up with a head injury, whether you're an athlete, whether you're a veteran in combat, a first responder, but also you can just slip and fall, right? You can have a car accident, like anything can happen. And while there is a lot of research to help people heal or to try to find a way to heal from the brain injury, we haven't found the solution yet. But there is a lot of promising research, notably Ibogaine therapy, which seems to be one of the most promising one in the realm of psychedelic research. A paper was just published early January out of Stanford. It is really promising because it's the first treatment that could potentially change the course of how we treat a traumatic brain injury. Currently, it's a mix of symptom managing drugs, right? So we're going to symptom manage the the depression that might happen, the anxiety, everything that's related to this like shift in quality of life that happens after brain injury, because we become, like you said, more sensitive to certain stimulus. So like sensitive to light, sensitive to sound, we're not sleeping well. And eventually this is going to snowball and it's going to make us more irritable and moody, and it's going to negatively affect quality of life. So like I said, it's a lot of symptom management, but I don't think it's adequate. And a lot of people in the field don't think it's adequate long term. We need something that's going to actually treat the physical trauma, and also the emotional trauma that comes with the injury. And so it's really interesting to see this research with Ibogaine. Something that's really impressive about it is that there were no negative outcomes. There were no adverse events in this study. It also helped with suicidal ideation, which is huge because that's very treatment resistant. And to the point that you were making about what people don't often talk about is that what happens as a result of the injury, either through the physical impact or just from brain hemorrhage and increasing the intracranial pressure, is a shift on that HPG axis that we talked about. So the hypothalamic pituitary gonadal axis, but also on the adrenal axis, also on the somatotropic axis. And so that's going to affect how the body is producing hormones, the sexual hormones that affect our libido, our fertility, and even our menstruation. It's very common that people who have even mild brain injuries, but especially in the moderate to severe, they'll see interruption of their menstruation, erectile dysfunction, infertility, decreased libido. We've also seen the inverse, where people become hypersexual as well. And when you're the partner or a family member, loved one of a person who's going through this, it could be very difficult.
Yeah.
And so what I'm trying to do with research and education and, speaking publicly about these topics is just to sensitize people to this issue. I would love for people who experience traumatic brain injury to speak to their physicians, to their therapists about it, because they need to put it on the radar. It must not be a taboo subject that people shy away from. It's really important. I've spoken to people who've told me that their physician didn't bring up their sexual health until 1 or 2 years even post TBI.
Wow.
And it's not it's nobody's fault. It's just that
Sure.
it's not something that's focused on in medical practice or even in
Mhm.
education. So it's not top of mind, but we can bring it to be top of mind, right?
Mhm.
And I would just love to see protocols coming out and just more education so that all kinds of healthcare providers can support their patients more readily. And I think that there's different ways that people can support their healing journey post TBI. I have a little list here that I'm going to pull up and share with you of things that seem to be working. So what happens after a brain injury is that there's an imbalance in all sorts of neurotransmitters and chemicals, but also things that are essential to our cognition, our focus, our hormones. So that's BDNF, glutathione, magnesium levels in the brain will drop sharply after a concussion, and so do zinc levels. So supplementing with magnesium, zinc, vitamin D, a B complex, glutathione, and even acetylcysteine, which is a precursor to glutathione, could be really, really helpful. And this isn't going to be a magic, solution, but these are things that your brain require in order to heal faster. And the same thing with protein. So engaging in a high protein diet. There's a lot of research, like I said, looking at Ibogaine therapy, but there's even research looking at psilocybin, because psilocybin can have an anti-inflammatory effect. And we're not looking at these psychedelic therapies for the acute phase of a brain injury. The brain needs to heal in a functional pattern, right? We need to give it all the tools to return to its baseline. So we don't want to alter states of consciousness and alter the regular processes of the brain when it's trying to heal. But for post-acute phase, right, maybe 1 or 2 or 3 years out, and even further down the line, these psychedelic therapies could be very promising. So lots of research still needs to go into it.
Mhm.
I think that the therapy component, the integration therapy that accompanies psychedelic medicine, is super key in this. It's not just about taking a drug, a substance, or a psychedelic. It's really the combination of both. But again, I think I'm very hopeful. And I think as long as we continue to educate people to come forward about what they're experiencing, it'll begin to be more of a priority amongst the medical community.
Well, that was fun. Thanks for tuning in, lovers. And if you want to experience more ecstasy and sexual liberation, head over to sexlovepsychedelics.com and learn about how you can join me for any one of my online or live events. And while you're there, grab my free guide on sex and psychedelics. Remember, this podcast is for entertainment and educational purposes only. Please contact your healthcare provider and local law before pursuing any of the products or psychedelics discussed. And one final note here. I make this show specifically for you. If you're loving the show, then be sure to leave me a review in iTunes or Spotify to let me know. Happy to be here and happy to serve. I'll see you next time on Sex Love Psychedelics.